Good day. Before we begin our presentation, I am Dasena Cheska and allow me to first introduce our group members who work together on this project proposal. Our team is composed of Dumalin Zamiel, Forto Tristan James, Hover Justin Jonathan, Valdez Jairus, Estacio April, Lazo Crisa Joy May, Mauri Jasrin, and lastly, Villanueva Chase Yuna. Together, we prepared our project proposal titled Improving Access to Quality Healthcare, a community-based health program. Access to quality healthcare is a basic right that everyone deserves. However, in our community, many individuals still struggle to receive a proper medical attention, especially those who are poor, living in remote areas, or lacking health awareness. These difficulties are made worse when hospitals are far, medicines are too expensive, and government support is limited. Because of these challenges, vulnerable groups such as children, the elderly, pregnant women, persons with disabilities, and low income families are affected the most. Through our project, we aim to address these issues by bringing healthcare services closer to the people. In doing so, we support two United Nations Sustainable Development Goals, the SDG 1, No Poverty, and SDG 3, Good Health and Well-being.
Many households in our community struggle to access medical services, and this creates several serious issues. When people cannot easily get the care that they need, illness worsen, health problems remain untreated, and preventable diseases begin to spread more quickly throughout the area. One of the major problems is the high cost of doctor consultations and medicines. Many families choose not to seek medical attention simply because they cannot afford it. Another challenge is the long distance between people's homes and the nearest hospital or clinics. Traveling far takes time, money, and effort, which discourages residents from seeking early treatment. Our local health centers also face a shortage of medical staff, making it difficult to provide consistent care for everyone. On top of that, there is a lack of medicines and proper equipment, which limits the type of treatment patients can receive. Even when people do decide to visit a clinic, they often experience long waiting times in emergency situations. The response is also slow, putting many lives at risk. Because of these combined challenges, many individuals delay seeking help until they are already very sick. As a result, treatment becomes more complicated, more expensive, and sometimes less effective.
These issues come from several key factors. First, many families face financial challenges, making healthcare something they simply cannot afford. Second, distance and transportation problems make it difficult for people, especially those in far-flung areas, to reach clinics when they need help. Third, there are system gaps, like the shortage of clinics, healthcare workers, and medical supplies, which slows down the delivery of quality care. And finally, a lack of healthcare awareness means many individuals don't know about preventive care or early treatment, causing health problems to become more serious over time.
So, let's move on to our effects on the community. These problems affect the community in three major areas. First, these health effects, such as more untreated illnesses, higher risk of complications, delayed diagnosis, and spread of infections. The second one is economic effects, such as higher medical expenses, families falling into debt, workers missing work, and increased poverty. The third one is social effects, such as lower quality of life, children missing school, and less trust in health systems. And the last one is growing inequality between groups.
The goal of this project is to make healthcare easier to reach for everyone in the community. We want to bring essential medical services, clear health education, and the support people need right to where they live. By doing this, we remove barriers like distance, cost, and lack of resources, making quality healthcare something everyone can access and benefit from.
Now, let's move on to our objectives. Our project aims to number 1, to provide a free or affordable medical checkups to community members. Number 2, to educate residents about proper hygiene, disease prevention, and basic health practices. Number 3, to establish a network of trained volunteers who can assist in community health activities. Number 4, to organize mobile health caravans to reach remote or underserved areas. And lastly, to collect and analyze health data to better understand the community's needs and improve services.
This program brings medical services directly to people in the community every month. Service included is free checkups with doctors or nurses, basic health monitoring, blood pressure, weight, blood sugar, and temperature, free medicines and vitamins, health lessons on hygiene, nutrition, family planning, and disease prevention, first aid for minor injuries, and referral to hospitals for serious cases. The program is flexible and can grow as needed.
The project activities includes meeting with barangay leaders and partners, recruiting volunteers, collecting medicines and supplies, organizing monthly caravans, setting up temporary health stations, conducting workshops, collecting health data, and following up with patients.
For our project timeline, we divided our work into four main phases. First month. During this month, we focus on organizing everything, identifying what we need, finalizing the goals, and making sure our plan is realistic and doable. Second month is for preparation. Here, we gather the needed materials, coordinate with partners, and finalize the logistics so we're ready for the actual launch. Month 3 is the launch. This is when we officially start the project and begin delivering services we planned, especially the first health caravan. Months 4 to 6 for monthly caravans and monitoring. Every month, we conduct follow-up health caravans and monitor the progress of the project to ensure our activities continue to help the community effectively. Overall, this timeline helps us stay organized and make sure every phase of our project runs smoothly.
The project is realistic because it relies on volunteers, existing community resources, and small budgets. With community members assisting in basic tasks, the need for additional staff and high expenses is reduced. This makes the project more sustainable and easier to manage. Using mobile health caravans also strengthens its feasibility. Instead of building new clinics, which would require large funds and long-term maintenance, the caravans bring medical services directly to different areas. They can rotate on a regular schedule, allowing more people to receive checkups, consultations, and basic treatment without traveling far. By maximizing what the community already has and focusing on mobility, the project delivers essential health services effectively, even with limited funding.
With this project, we expect easier access to healthcare, early detection of illnesses, lower health expenses, better health knowledge, stronger community support, and a healthier and safer community.
This project is highly feasible because it relies on volunteers, existing community resources, and minimal funding. Using mobile caravans makes it possible to deliver service to multiple areas efficiently without the need to construct new facilities. Alignment with Sustainable Development Goals or SDG, we have SDG 1, which is no poverty. This project helps families reduce medical expenses by providing free or low-cost health services. We also have SDG 3, which is good health and well-being. It supports healthier communities through accessible health service, health education, and preventive care.
In conclusion, many families in our community still struggle to access quality healthcare due to distance, high costs, and limited resources. The Community Health Caravan offers a practical solution by bringing medical services, checkups, and health education directly to the people. Through teamwork, volunteers, and strong community support, we can reduce health gaps, promote early treatment, and improve overall well-being. Together, we can build a healthier, safer, and more empowered community for everyone.